I think it's not all care that's received, but how much it costs to provide. Let me just give you one example. I was talking with the CEO of a big integrated group staff model plan a couple weeks ago. And I was asking him how his various IT investments were doing and so on. He said, let me give you an example of how they work for us. It used to take 43 minutes for one nurse at the end of a shift to explain to the next nurse all about the patients and what specific things they needed and their medications and so on. And because we put in a better IT system, it now takes 12 minutes, which means that we now have 31 more minutes of nursing time per shift than we had before. And so that's 31 more minutes of patients to be saved, or 31 fewer minutes that they have to pay for the same thing. And so that's the kind of stuff I think that's in there, not just who's getting an operation that doesn't need to get it, but how efficiently is it delivered. And the efficiency with which it's delivered is so poor that you kind of have the sense that doing anything to save those 30 minutes add up very quickly.
David, you said you'd cover, the Obama plan would cover 98 to 99%, which means taking 16% of uninsured down to 1 or 2. That's quite ambitious. So my question to you is, without mandates on adults, it's easy relatively to mandate kids, or other means, what's your thinking about how to get those free riders? I'm thinking about myself when I was 22 and hitchhiking around the country, and I can tell you that health insurance at $2 a month was not cheap enough to get my interest. And then the question that I have for Gail is, actually, is universal coverage your candidate's objective?
For essentially everyone out of the immortal range, you know, the people who know they're immortal and don't want to hear otherwise. When you ask them why they're uninsured, they will tell you it's not because they don't want it, but because they can't afford it and they don't find it accessible. So that the vast bulk of the uninsured you pick up that way by making it affordable and accessible. In addition, there are two other parts of what Senator Obama has said that I think are very important here, actually, and have really not been stressed enough. One is that Senator Obama has proposed that children up to age 25 be covered under their parents' policies, regardless of whether they're in school or not. Those 22-year-olds are very, very cheap. Most of their parents will have insurance, so actually adding them to their parents' policy does not cost very much and will cover quite a lot of them. That's one thing. Second is, the thing we know about a lot of people is that they do whatever the kind of default option is. And let me give you an example from pensions. If a firm goes to a worker, we've seen this, you know, a big firm goes to a worker and says, we have a 401k plan. Here's a form, fill out this form, give it to us, and you'll be enrolled in the 401k plan. About 40% of people enroll. The rest say, yes, I want to enroll, but I have to go study the choices, and I'll do it tomorrow night, and I'm busy this week, and I'll do it next week. If instead the firm does exactly the same thing, but it goes to the worker and says, we have a nice 401k plan, we know that most employees want to be enrolled in the 401k plan, we've put you into the 401k plan, but if you want to be out, just sign this form, check this box, and we'll take you out. 90% of people stay enrolled. So the very act of whether you check a box to be in or check a box to be out has an enormous impact. And the way that you can deal with a lot of people, and Senator Obama has proposed this on pensions, and he also believes it on healthcare, is you make it easy. You make being in the default, not being out the default. And you say, look, we believe this is important to you. You're going to get a tax credit for it because when you're 22, you don't have that much income. We're going to send it to this insurance company. It's there for you. But if you really, really don't want to be in, then you don't have to. What he's also said is, by the way, if it turns out there are pockets of people who still won't be in, and we know that it's affordable and we know that it's accessible, then he's open to a mandate. But the first thing you have to do is make it be affordable and make it be accessible. Get as many people as you can enrolled, and then come back.
The objective is to provide a financial means for people to buy insurance and to give them ways to access what will be lower cost insurance. And it is very much to make sure that people are able to have access to a more affordable insurance plan than has been possible in the past, and to try to help those who are high cost to be able to be responsive to that. With regard to the immortals, and we know that there's a disproportionate number of people who are in the 18 to 26 category who go without insurance coverage. As David said, Senator Obama lets them be on their parents' plan. Senator McCain would give them, as individuals, a tax credit, which clearly for this group would make it, $2 a day insurance would easily come in your refundable credit. Whether or not some of your other Massachusetts colleagues are correct, who were estimating that without a mandate, you could have as many as 5% without insurance coverage, we'll have to wait and see. It's because of all of the problems that arise with regard to mandates. It seems to me that whatever your strategy and whatever your political party, making a significant effort to make more affordable insurance available is a perfectly appropriate first step. And if it doesn't solve all of the problem, we can see how big the remaining problem is and decide what we want to do about it.
What do you think will happen with Medicare under two potential different administrations, particularly with Medicare Advantage, the structure of payment, the overall crisis in physician payment?
The focus thus far, not surprisingly, have been on the more global issues with regard to expanding coverage and trying to find ways to slow spending. And the level of discourse, as best I can tell in both campaigns, has been laying out the notion that we need to change reimbursement so that we reward the kind of behavior that we want to see. Senator McCain has indicated in terms of a coverage issue that just as Part B now has smaller subsidies for high-income seniors, that he thinks that's an appropriate consideration for Part D or others, but this is not a part of the direct campaign. The issue about the delivery change is one that, particularly with the physicians, really has to be taken up. And the pressure is probably going to be first and foremost on the Congress, because they, for better or the worse, have been the ones digging themselves into a hole that has grown completely out of any kind of proportion, and have done so in a way that has incentives that are somewhere between unhelpful and perverse. Senator McCain has talked about encouraging coordinated care, trying to, either through Medicare Advantage or through other mechanisms, be able to have care coordination is something that is very important. I don't know of anything, say, that would be against the medical home model that has been raised. It is the one part of Medicare that is going to force itself on the system, because as any physician who has paid attention knows, we fall off the proverbial cliff January 1st, 2010, when the last patch wears off, and instead of having a 4% decline or a 10% decline, you're now facing a 20% decline.
The first baby boomer will retire in the next president's first term. In 2010, Medicare will be spending more money each year than it takes in, and by 2019, the Medicare Hospital Insurance Trust Fund will be exhausted. So what will your candidate do to ensure that Medicare is solvent when the people in this room need it?
Let me give a couple of answers to it. One is the current standard that we use for thinking about Medicare, 75-year actuarial projections. Nobody has a plan for 75-year actuarial balance in Medicare the way that the program looks now. What we need to do, I think, is to take the steps now that put us on the best path to being able to realize a financial solvency for Medicare. And there are a couple of parts to that. One is the kinds of things that we were both talking about in terms of reforming the delivery system inside and outside Medicare. Second, there are issues about trying to allow and create incentives for people to work at older ages when they're very productive, so that they can be contributing in terms of Medicare taxes coming in. Each of those are solutions. And finally, I do want to come back to this because, the public finance person in me really cringes. I think it's just completely irresponsible to promise the Bush tax cuts 2 times over when you know you don't know how to afford Medicare, and that's the only source of money. So one of the things that Senator Obama has been very clear about is not using whatever money we may save in those programs to fund high-income tax cuts.